Hey there, Dr. Ryan Hetland here at River Heights Health and Injury Clinic, Inver Grove Heights Chiropractor, Gonstead Chiropractor. I'm here with Tammie. Tammie works for our team. She gave us permission to show you her first adjustment. And so we're going to show you her x-rays and just a little bit about what we're going to do for her adjustment and why we do it. So come on over here while I explain this to you and Tammie. I'll let you in on this. We took x-rays. Tammie's last visit told me kind of she had pain down in her hips here. That just started recently, maybe with what we're doing with spinal disc decompression in the office. But she started getting pain down here. We're just evaluating her for how her spine looks. And I already did the evaluation. We're picking it up here. I took the x-rays already, and we're going to show you what these x-rays look like down on her hips. So let me pull this low back x-ray up. And what you're going to see here is her hips. So where you're talking about down on the hips here, those bones are right here. So we're just checking to see if they're symmetrical and if they look good. And actually they don't look bad, and they look fairly symmetrical. What I'm going to point out to you though is this is her hip alignment that looks fairly flat with the ground. This is the sacrum alignment, which looks fairly lined up with that. But when you look at the bottom vertebra here, that's not in line, and you can see how that's tipping over and creating pressure onto those SI joints, and that is why she's getting some discomfort down there. And when we look at the disc, which is in Gonstead one of the most important things to look at, evaluate, make sure that's healthy, the discs themselves look fairly good. So at this point we're just assuming the alignment is the biggest issue for her down in her low back. I'm going to quickly show you her middle back, because that's not a problem area for you, but obviously when we look at this thing, this line, you know, the spine should track a line, that plumb line there, and you can see how she has this scoliotic type looking curve there. And so you can see this spot right here where it's level again, and then the vertebra itself is tipping like that. So for me, that tells me how I should adjust her to make the best correction possible, and you'll see me do that with our Gonstead technique that I use in the office here. And in her neck, when we look at the discs in there, you can see how the disc, when I zoom into that spot here where it was buckling earlier, that disc is starting to wear out because the vertebra has been sitting out of alignment and grinding abnormally. So the purpose of the adjustment is to, as precisely and accurately as possible, realign that vertebra and restore its normal motion. The disc doesn't have blood flow, and so that relies on healthy aligned motion to restore the normal pumping action that disc has. The disc normally pumps to get fluid in and out of it, and when you lose that normal pump, it will stop restoring the fluid in and out of it, and it will dehydrate. And what you end up with is we can start to see degeneration, arthritis in the spine that's progressive. So if we leave this thing in here and we don't fix this, it'll just continue to degenerate and create chronic problems for her, which, assuming, Tammie, you do not want.
No.
Okay, and in the neck we have a similar issue here. I'm not going to dive into every detail, but when we take x-rays, we do an evaluation. This is part of figuring out what's required. Now I'm going to show you her first adjustment. She's a little nervous. Nervous?
Yes, very nervous.
So I wanted you to catch this because this is just real. Sometimes you get anxiety from coming in, but it's amazing. You'll see how after the adjustment she gets, it's so easy and it doesn't hurt and it feels really good. So we're going to start with her low back. Pull this up so I know I'm adjusting her properly. Come on, and I'm going to get a piece of paper for you. Go ahead and lay on your side there and face out towards me. So I'm just going to put her in a position that works comfortably for her and sets her up so I can adjust her well. Scoot your hips a little bit forward towards me. That way. Relax there. Come on over here, Nicole. So the difference between a Gonstead adjustment in the low back and general twisting type adjusting, where there is this. Normally you'll get this big twist like this. Is that comfortable? Not really. It's okay. can handle it. But it's this big twist thing, and you get a lot of cracking going on with the whole pelvis. What I'm going to do here is try to keep the spine neutral so we're not twisting it. Twisting it's very compressive, and we don't want to compress it, as we want to decompress it. So I'm going to use my leg and support her as we roll her forward. And you relax there as best you can. You're doing great.
Oh.
Good job. So now she made a noise. You hear that? So come on up here.
I didn't do it on purpose.
But how did that feel? Was it painful when it moved?
No, I mean you can feel it.
You can feel it move,
Yeah.
but it wasn't getting more shocking, right?
It was, yeah, I didn't know what to expect.
So here's the thing, when you're new, you don't know what to expect, so that's pretty much 99% of what people experience. They're a little nervous maybe you won't be nervous, but a lot of people have a little bit of anxiety. And they maybe say ouch, but it really doesn't hurt because they're just shocked more at what is going on, especially when it's your first adjustment. But adjustment shouldn't hurt. However, sometimes when you move a joint that hasn't moved for 30 years or 20 years or however long, or it's bruised because of an injury, it can be a little sore just from working on it, and that's normal, but the adjustment itself shouldn't hurt. Come on over here. I'm going to have you switch spots here with me. Stand up here and face right into here. There you go. This table makes it comfortable for people with injuries to get on and off. And if someone is pregnant in their later, where your bigger tummy, this thing gives and can lock out to make it more comfortable as well. A lot of great things for comfort here. Now I'm counting down the vertebra to make sure I'm on the right one, and I'm going to use perfect positioning here. Now that already went.
Mm-hmm.
Did you feel that as I was just kneeling in there?
Mm-hmm. Yep.
So, comfortable?
Yep, very comfortable.
Okay. So that move there. I'm going to check the neck. Just doing very light work up here because it's not really her problem area, and normally I would just work on the problem areas for people, but with her, she just wants to make sure the spine's moving, and we want to address everything, and I want you to be able to see kind of what we do. And this is a part where on x-ray is probably the worst, but she's not even feeling a lot of problems up here. So a lot of times I might just leave it alone if the patient desires that. Do you want me to leave it alone, or you want me
Sure.
to? Should we leave it alone?
It doesn't hurt. I mean, it's fine.
Okay,
Yeah.
let's leave it alone. So normally if we did do a neck adjustment, it'd be seated, and we would do it where we weren't twisting the neck, and it would be very controlled and gentle as well. But you get the idea of what's kind of going on there.
Mm-hmm.
And what do you think?
That was good.
First
Yeah.
time's over and,
Yeah.
and not as bad?
No, it was not bad at all.
Okay, cool.
It's great.
We might have a follow-up video just on the second or third, just so you see if she's sore or how she's doing after this. So hope that you like that, and we'll see you later.